Okay, well, we're going to talk now about what happens after someone has a stroke. Well, the first thing that happens is they go to hospital, and hopefully we've got them there quickly. The doctors have assessed them and they're getting treatment, which if it's a blood clot, then they give them medication to dissolve that clot and get the oxygen back to those brain cells. If it's, as I said before, if they're actually bleeding, then there are a lot of problems there controlling that situation. But then after a while, the person physically recovers. Well, actually physically they may not be all that bad, but they start to stabilize. In other words, there's no more damage to the brain. What we have to do now is help that person get back to something approaching normal. Now, someone's never going to get back to 100% of where they were. They've had some permanent damage to their brain, but in fact what can happen is the brain can relearn how to do things that have been interrupted by this event. They relearn how to walk, talk, think about things, and some people can make a very good recovery. But it's always with the help of particular types of therapy. Now, there's three types of therapy that are very important for stroke, and we'll talk about a bit of those at length, because the main one I see is a physical therapy. Most people have some sort of weakness, and they have to relearn how to use their arms and legs, because there's nothing wrong with their arm. The muscles are still there, the bones are still there, everything's working normally. The only thing that's wrong is the brain's not able to give it that instructions, okay? And what the physical therapist does is they put them through specially designed exercises to get those muscles working again and helping that person relearn how to do things. Now, what will generally happen is they will still have some function, but they'll feel weak. And what the therapist will be trying to do is to get the person to think about moving. They might not have much strength, but they'll be able to move a little bit. And over time, the therapist can help them build up that strength, which is really just re-establishing those nerve pathways to get the muscle working again. The other thing that can go wrong, as we spoke about before, is speech. And there's two ways that can be a problem. One is the muscles of the face and the throat and the larynx, where the voice comes from, might not be working because of damage to the part of the brain that controls those muscles. And the other part of damage that we could see is damage to the language center. So the person might be able to speak okay, but they simply can't find the words. The memory of how they can construct syntax and grammar has been jumbled up. They've forgotten words, or they're using the wrong words. So the speech therapist will do a number of different exercises, and these are things, again with the physical therapy, these are things that caregivers and the family will be doing at home. So once the person is out of rehab and they've gone home, these are the sort of things that the caregiver will be doing. Teaching people how to speak again, well, if you remember when you're a kid learning how to talk, learning new words, they'll use different things, sometimes flashcards, so you show them a picture of an object and they have to try and find the word for it. And this can be very rewarding for the person, because it's like a game. And you know, as they get things right, as they improve, it gives them that sense of achievement. And speech and language and physical therapy will go on for many, many months. Hopefully we can get back to a stage where the person is functioning again independently, but they might have some sort of residual weakness or residual deficit. Now, occupational therapy is a really important therapy because this is the one where the therapist is trying to look at how the person is functioning in their normal environment, looking at what occupies their time. So the occupational therapist is very important, because when they're doing their assessment and their therapy, they're trying to look at how the person is operating in their environment. Are they able to do the sort of things that they were doing before? Can they turn on a tap? Can they fill up a glass of water? Do they know how to put away things into wash their clothes and put them away? Do they know how to water the garden? Do they know how to, organise their life? So the occupational therapist is not really looking at the physical deficit or the speech deficit. They're really looking at what is missing from this person's normal life. And they're trying to help them and help the family design where they're living so that they can get back to normal. And sometimes this involves making some modifications around the house as well. So when we're talking about the role of the caregiver in helping someone after a stroke with their therapies, one of the key things to do is not so much to take over and do things for the client, but to help them do it themselves. So in other words, if you're helping a client go to the bathroom or have a shower, what you're doing is helping them do it safely, but not doing everything for them, because what the therapists want to do, they want the person to be able to do it themselves. So your role as a caregiver is to help that person but not take over and do everything for them. What you're there to do is to support them so that they can learn how to do things themselves again. So the key points for caregivers to understand is the person having a stroke will be in hospital. They might be in a rehab centre for a few weeks, but then after that there's many, many months of improvement and therapy that they have to continue on with. And that's where the family and the caregiver comes in, because the caregiver is going to be the one often staying with them 24/7 or many, many hours per day. And the more that they understand how these therapies can help their client, the better off the client's going to be.